Today's lifestyles have become faster and more furious than ever. We do more, excel faster, and deliver more productively than ever before. We eat with irregular eating habits, not necessarily what we want, but what is available with the time restraints that we have. Fast foods, although they appease our taste, do not provide the proper nutrition that we need to stay healthy. Our hurried pace, processed foods, and lack of exercise can stress our health and digestive system beyond its tolerance. We begin to experience symptoms of unease, fatigue, headaches, indigestion, and constipation. We tend to self-medicate with over-the-counter preparation, which may cause additional discomfort and damage to the valuable organs responsible for processing this demand and eliminating its waste. Laxatives that we take act as chemical irritants. They stimulate the muscular walls of the colon to abnormally contract and expel the irritating substances. It is very easy to become dependent upon the drugs and permanently destroy the normal ability of the colon to eliminate naturally. The colon's main function is the absorption of water and minerals and the formation and elimination of feces. Research has shown that regular use of refined carbohydrates and lack of natural fiber increase the transit time of bowel waste and stimulate the production of putrefactive bacteria in the bowel. Both of these factors have been linked to constipation and several bowel diseases, including diverticulitis, colitis, and colon cancer. At least 2 million Americans suffer from inflammatory bowel disease. When toxins are created in the body much faster than can be disposed, the blood capillaries to the colon begin to pick up noxious debris and permeate through the colon wall, affecting other tissues and organs of the body. Today, in the United States, colon cancer is the second leading cancer killer of women, with rectal cancer having a higher occurrence in men. What can one do to minimize the exposure of the colon walls to potential carcinogens? This question is easily answered by millions of individuals each year.
As a child, I've always suffered with chronic constipation, along with irritable bowel syndrome and spastic colon, and colonic therapy has truly helped these problems.
Colon hydrotherapy has been a very big part of my life as far as detoxing. I'm in the pest control industry and around chemicals all day long. And after a while, you build up a certain amount of toxins from that. And after I have the therapy, I feel 100% better.
Colon hydrotherapy is the safe, gentle infusion of filtered, purified, warm water into the rectum from a closed system using no chemicals or drugs. It is a painless procedure, which is both relaxing and effective. The Toxygen colon hydrotherapy machine provides 3 stages of water filtration. This modern filtration system removes the harmful effects of chlorine, pesticides, herbicides, bacteria, and many other toxins. Periodic cleansing of the colon dilutes the toxic concentration in the large intestine, reducing the load on the liver and lymphatic system, allowing the eliminative organs, such as the skin, lungs, kidneys, and the bowels, to equalize the removal of such toxins with their production rate. A previous colon therapy, which we all know as an enema, limits the cleansing to the rectum to sigmoid area. Colon hydrotherapy allows water to filter throughout the entire colon and up to the cecum. Today's colon hydrotherapy with modern instrumentation offers the safest and highest level of results to the client. Each year, hundreds of colon hydrotherapists become certified in this field. IACT, the International Association of Colon Therapists, provides certification on a national level.
IACT is an international organization focusing on education and integrity in the field of colon hydrotherapy.
Colon hydrotherapy affords physicians as well as the individual a valuable healthcare modality in treating disease and promoting wellness. Many health authorities believe that disease begins in the colon. To be in optimum health, the colon must be functioning properly and free from impactions. Colon hydrotherapy cleanses the entire colon without stressing the individual. This method provides a closed system in which waste material is eliminated through the instrument and out the drain line, avoiding any offensive odors and maintaining the dignity of the individual. A colon hydrotherapy treatment usually only lasts 45 minutes. The session commences with a comprehensive medical history form completed by the client. The therapist reviews the form and discusses pertinent details relating to present symptoms and is alerted to pre-existing contraindications. Explain the total procedure to the client to relieve any anxieties concerning the treatment. Ask the client to use the bathroom to empty their bladder. The therapist begins by putting on examination gloves. The sealed disposable packs should be opened in plain view of the client. If it is a first-time client, describe the disposable pack to them, emphasizing that it is for single use only and will be disposed of upon completion of the session. With the client on the table, gently palpate the entire abdomen for rigidity masses and pain before starting the session. The therapist should then instruct the client to turn to their left side for the insertion of the speculum. After the speculum is lubricated, it is inserted into the rectum approximately only 2 to 3 inches. The obturator is removed and disposable hose is attached to the speculum waistline fitment. After insertion is complete, ask the client to slowly turn onto their back with knees bent. The inserted speculum can now be secured and prevented from slipping out by placing a previously cut strip between the V formed by the waterline and waistline. One end of each of the cut strips should be placed under each buttocks. The colon therapist sets the thermostatically controlled mixing valve to the desired operating temperature of 100 degrees Fahrenheit and sets the time on the instrument 30 to 45 minutes. The water flow control valve is then opened slowly while observing the pressure gauge, allowing pre-warmed water to flow at a rate of approximately 1/2 pound per square inch. Water flows in and out of the colon for 5 minutes. During this initial flow cycle, the waist valve remains open. Gentle massage is applied on empty cycle in a clockwise motion, starting on the lower left quadrant along the colon working upward, across and then down to the cecum. This will help facilitate the flow of water to the region. After the initial flow cycle has been completed, proceed on with the fill cycle. Place waist control valve in the fill position. Turn the flow control to 1/8 to 1/4 psi setting. Let the pressure gradually rise to 1 to 1.5 psi setting. However, the client may indicate a desire to empty before this time. The slower the fill, the more water the client's colon is available to accommodate. The filling cycle should be approximately 30 to 60 seconds, depending upon the sensitivity of the individual. In most cases, the maximum fill time is 60 seconds, and then proceed to empty cycle. When employing the emptying cycle, turn the waist control valve to the empty cycle, then adjust the water control valve to 2 to 3 psi setting. This will facilitate the removal of water and waste material from the colon. The higher the psi setting, the faster the water flows out of the colon. If waste material is to be inspected, a psi setting of 2 or less is recommended. In the event that waste material is not released through the waste hose on the emptying cycle, squeeze the waste hose rhythmically several times. This will help break up the fecal material that is too large to pass through the speculum opening. Repeat the filling and emptying cycle for the balance of the session. Throughout the session, the gentle abdominal massage should be continued on the emptying cycle. Use the pads of the fingertips clockwise in a slow dipping motion, starting at the lower left quadrant and proceeding upwards along the descending colon towards the splenic flexure. Proceed with the gentle massage along the ascending colon to the cecum, and then reverse the procedure. At the end of the session, when the water is flowing clear, close the water flow control valve, leaving the waist control valve open. Make sure the client has finished draining and have them turn to their left side and remove the speculum. Raise the speculum with the waste hose still connected so that residual water and waste can drain through the instrument. Then assist the client to the restroom to evacuate any residual water. Disconnect the waste hose, the water line, and discard along with the speculum and obturator. This eliminates any contamination to the client. Following a colon hydrotherapy session, the instrument is cleansed and disinfected. Connect cleaning and disinfecting waterline attachments to the instrument. Turn on the master mixing valve to hottest position. With the waste valve in the empty position, Turn the cleaning system water valve to on position and allow water to flow through viewing tube and drainage system of instrument for approximately 1 minute. Viewing tube should be entirely filled with water. Engage germicidal solution injector valve, allowing solution to enter the viewing tube for approximately 10 seconds. Turn waste control valve immediately to fill position. Viewing tube should be completely filled. Then turn the cleaning system water valve to the off position and disengage the germicidal solution injector valve. Allow solution to remain in the viewing tube and drainage system for 10 minutes. Never leave cleaning fluid in the viewing tube longer than 1 hour. After time has lapsed, turn waste control valve to empty position. Turn the cleaning system water valve to the on position, allowing water to flow and flush the viewing tube and entire drainage system. On a weekly basis, the viewing tube should be cleaned with a long, soft brush. Now finish cleaning the exterior machine with disinfectant and the table. The benefits of colon hydrotherapy are numerous and beneficial for the following conditions: constipation, diarrhea, atonic or sluggish colon, hemorrhoids, intestinal toxemia, bowel training, para or quadriplegics, prevention, preparation for diagnostic study, barium enema, sigmoidoscopy and colonoscopy, surgery pre and post-op, and following pregnancy.
The use of colon hydrotherapy in the medical field is becoming more prevalent every day. Doctors and therapists alike are now realizing that periodic cleansing of the colon can prevent stagnation and minimize the exposure of the colon wall to potential cancer-causing agents. I recommend colon hydrotherapy for many of my patients.
I've been a licensed colon therapist for over 7 years, and it still amazes me the variety of people who every day seek out colon hydrotherapy. Ranging from the young and old concerned with symptoms of constipation or irritable bowel, to the extreme handicapped quadriplegic whose former treatment consisted of digital stem, chucks, and a bedpan. Hundreds of clients have found that by including colon hydrotherapy to their nutrition and exercise program, they feel better, respond quicker with this safe and natural health care modality.
The Dotolo Research Corporation, the originator and world leader of Toxygen colon hydrotherapy equipment, has spent over 20 years designing modern instrumentation for colon hydrotherapy and now affords the client a safe and effective healthcare modality. Through the Dotolo Institute, a licensed post-secondary school in the state of Florida, individuals learn the history of colon therapy, the anatomy of the human digestive tract, basics of nutrition, the physiology of the digestive tract, and the colon hydrotherapy treatment procedure.
We work with everything from spasmodic colons to certain forms of cancer, from referrals from hospitals and doctors. But basically, we work on people that are interested in changing their death styles to a new lifestyle.
My practice has been very rewarding to me, not only spiritually, but very health-wise.
Good health is as much a function of our elimination as the quality of the food that we ingest. Considering that over $400 million are spent annually on laxatives, 140,000 Americans are diagnosed with colon rectal cancer, and of this group, 44% will die as a result of this disease. Colon cancer is the second leading killer in the U.S. The choice is yours. Periodic cleansing of the colon could prevent stagnation and minimize the exposure of potential cancer-causing agents to the colon wall. It is a natural, safe, and effective healthcare modality now recognized all over the world.